Bill and Melinda Gates Foundation wants to reduce the rate of death for newborns and young infants in poor countries. The foundation is pledging nearly $130 million to develop vaccines for maternal immunization targeted at low-income countries. Somebody who's really excited about this is Professor Shabir Madhi, South African Medical Research Council's Director of the Vaccines and Infectious Diseases Analytics Research Unit. Prof, good afternoon. Welcome to today. When I saw the press release, I see it's going to be a targeted contribution to the development and accessibility of important maternal vaccines. How significant is this?
So, good afternoon, Dan. Thank you for having me. And the short answer is for countries such as South Africa, and in fact, many African countries, where more than 50% of all of the children that die before they turn 1 month of age occurs. This is a major development. The two diseases which are being targeted are diseases, again, for which the majority of death actually occurs in African countries. And South Africa, for one of those two diseases, actually reports the highest number of cases per capita compared with anywhere else in the world. So this is a significant development and probably the way to go when it comes to trying to protect children in that first months of life, when you can't vaccinate the children directly to protect them against these vaccine-preventable diseases.
Yeah, can you just share a little bit more about these diseases? I'm not going to even to attempt to pronounce them because of the name, but one is known as GBS, the one is RSV. They are said to be two of the leading causes of death for newborns.
Yes. So GBS stands for Group B streptococcus, and this is a bacteria that about 1/4 of pregnant women, 1 out of every 4 pregnant women, is colonized in the vagina. The majority of children that are born to these mothers, fortunately, won't develop what we call severe disease after they're born. But unfortunately, 3 out of every 1,000 children in South Africa, as an example, will develop what we refer to as invasive GBS disease. This is infection around the brain, infection in the blood, and about 1/4 of those that develop this illness, unfortunately, will demise. And of the survivors, roughly about 1/4 will actually have long-term sequelae, including brain damage. So that is with GBS. The other vaccine that's being developed is for a virus known as respiratory syncytial virus. Now, this will be a major development, not just for children under 1 month of age, but even for children up to 6 months of age, because we expect these maternal vaccines to protect children at least up to 3 to 6 months of age. This particular virus, as an example, in almost high-income countries as well as low-middle-income countries, including South Africa, is responsible for between 35 and 40% of all children that are hospitalized for pneumonia. So it's a leading cause of hospitalization for pneumonia, which is an infection in the lung. And again, it contributes to roughly about 100,000 children dying each year, of which 50% again occur on the African continent. But the biggest value here is that it would substantially reduce the burden on our healthcare facilities if we are able to prevent these children from being hospitalized. Now, again, as I mentioned earlier, children can be vaccinated. There aren't any vaccines as yet to vaccinate children against RSV. But the problem is when we vaccinate them, we're only going to start protecting them from 3 to 4 months of age, whereas most of the severe illness from RSV occurs in children around about 3 to 4 months of age. So we need to get protection much earlier. And the best way that's been proven in the past to protect children in the first few months of life is to actually vaccinate the mothers, and that antibody transfers over to the baby, and the baby derives protection as well.
So the idea, of course, would be to vaccinate the mothers even during pregnancy. Safety questions will come up. I mean, we've just been dealing recently in the world about the COVID-19 vaccines. Some people say vaccines are not safe. These ones have not yet been developed. The funding has now been put down by the Bill and Melinda Gates Foundation to the tune of nearly $138 million. Is the idea that they would be safe to be used on pregnant mothers?
So absolutely. So the RSV1 has actually undergone clinical trials, and we're hoping to get results of those clinical trials towards the end of this year or the first quarter of next year. And South Africa was integrally involved in the RSV program. The GBS vaccine is a bit more early in its development, and as you correctly point out, The studies to determine the safety of this vaccine for GBS will only start next year. Again, South Africa will be involved in that. But I think it's important to just know that currently pregnant women are vaccinated against other vaccine-preventable diseases, which has had a tremendous impact in equipping the children to survive in the first months of life. And in South Africa, as an example, pregnant women are vaccinated against tetanus, which is a condition that used to affect newborn babies in the first few days of life, as well as up to 1 month. And then many pregnant women in South Africa are also vaccinated against influenza virus and obviously COVID-19. So there is a history of vaccinating pregnant women, and in the past it's been remarkable as to how dramatic the reduction in death has been when we've targeted pregnant women for vaccination against diseases that occur in the first month of life in babies.
Yeah, it's very clear that it's a life-saving process that needs to be embraced. Just once again, Prof. Madhi, you said South Africa was very much involved with the RSV trial, but not so much GBS. Was that involvement by way of participating in it or contributing? Because you yourselves and your peers are wonderful scientists, as we've learned during the pandemic.
Yeah, so with the RSV, we were very much involved in the clinical development of the vaccines, where we're evaluating for safety and to see whether it protects the babies. In fact, with GBS, South Africa has been the leaders internationally on the vaccine development. We've been involved from day one, and in the first vaccine studies in pregnant women with a GBS vaccine that's being developed was actually undertaken in South Africa. That's currently being concluded. And the follow-up to those studies will again be done in South Africa and multiple other countries. So South Africa has been very much at the forefront of the clinical development of both of these vaccines in pregnant women.
Thank you very much, Professor Shabir Madhi, there on this good news story coming out of the United States, that the Bill and Melinda Gates Foundation and contributing nearly $130 million towards the development and accessibility of vaccines for 2 particular diseases that kill many children, especially in sub-Saharan Africa.